So A2, deficits in nonverbal communicative behaviors used for social interaction. We need nonverbal communication to add emotional valence, to illustrate something, to provide more information, or just to clarify information or elaborate on things. And that's all part of the same idea of building social connection, sharing interest and emotions around a concept. So what do we look for then in nonverbal communicative behaviors? It's not just about eye contact. One of the most common things we hear in referrals for autism assessment is, does this child make good eye contact? Query autism. That's important, it's a part of it, but it's more than that. Part of it is about integration of verbal communication and nonverbal communication. It's easy enough to get a message across to somebody using just words, but we had nonverbal communication to add color or emotional valence or to give more information about something. But then what we need to do is to really match that and to integrate it in a smooth way. So if I'm excited about something that's not the biggest deal in the world, do I show it on my face that I look a little bit excited? And is the intensity of my facial expression matched to whatever the experience or the concept was? If I'm a little bit upset about something, can I show a little bit of upset, or do I break down in tears? We often ask people, are there nonverbal behaviors? Do they seem exaggerated, or do they seem completely underplayed? Is there sometimes a complete mismatch? Do they often smile and laugh while they're telling you a story that's actually pretty sad? Or a lot of people with autism will reflect that I often get told that I look upset or that I look grumpy, and I don't feel grumpy. And so there's this mismatch between the verbal and the nonverbal communication. So what are some of the things you might ask or you might look for in getting a sense of that integration? It's, as I say, do their facial expressions and body language match the content of their speech? Do they smile when talking about something sad or look blank-faced when talking about something excited? Do their facial expressions and body language match the intensity of the moment? Do they appear to overreact, underreact, over or under-exaggerate their emotional response? And is there anything unusual about the way that they speak? So again, if I'm excited, I might talk at a slightly higher tone, I might talk at a slightly higher pace, versus if I'm sad, it's often flat and monotonous, slower in my speech. How do people kind of manage that themselves? How do they carry themselves in that way? Is their speech always flat and monotonous or robotic? Or is it always way too loud or always way too soft? Is there any sort of modulation in terms of the tone and the cadence? Those are also important parts of nonverbal communication that give you clues to the details about the content of speech. So then the second part, abnormalities in eye contact and body language. Eye contact is important in autism, but it's not all there is to it. Making eye contact with somebody is a way to communicate to them non-verbally that you're connected to them, that we're on the same wavelength. I'm looking at you, I'm talking to you, I'm connecting with you. It's not just about whether you make it or whether you don't make it, it's about how well you modulate it. Under normal circumstances, you wouldn't just make eye contact with somebody and hold that fixed stare the whole time. It gets a little bit creepy, makes people feel uncomfortable. And so under normal circumstances, you would look at somebody while you're chatting, then you might look away or you might look at somebody else. You just break it ever so slightly for it to feel natural. You might ask people around whether they make eye contact, do they hold a fixed stare, can they make and break their eye contact in a normal, natural way. And likewise with body language, it's not just about whether they use body language or not, which is a reasonable question. Are they completely stiff and still all the time? Do they sit and hold a strangely still posture throughout a conversation or throughout an interaction? Do they use body language at all? And do they direct their body language to you or to the other person? So if they're very happy and excited about something, do they integrate that with eye contact and look at you to show you that they're happy and excited? Or do you kind of have to read it off them? Can you see that they're very happy and excited with a toy, and it looks as though they're communicating their excitement and their joy, but actually they don't look at you to show you, to direct their joy towards you? And this is where sort of the finer nuance comes in. When they're in an interaction with you, say you're playing a game with a child and they're very excited and they're laughing and they're squealing and it's obvious that they're enjoying it, if they don't look at you and if they don't direct their joyful expression towards you, it's not obvious that they're enjoying it with you, enjoying the social aspect of the game or of the play. And that's really important because that's, particularly in children, that's how we build relationships.